Hi, my name's Daniel Nurse Brown, and I chose to do my presentation on Parkinson's disease. What is Parkinson's disease? According to the Parkinson's Foundation, Parkinson's disease is a neurodegenerative disorder that affects predominantly dopamine-producing neurons in a specific area of the brain called substantia nigra. Nerve cells in the brain which control movement begin to die, along with nerve endings that produce norepinephrine, which affect heart rate and blood pressure. This results in difficulty with fine motor skills, walking, talking, and uncontrolled muscle spasms and shaking. This affects 1% of the population above 60 years of age, and famous people such as Muhammad Ali and Ozzy Osbourne have had Parkinson's disease. When diagnosing Parkinson's, there's no test to see if the patient has had Parkinson's disease, and a diagnosis relies on a review of medical history and symptoms. In some cases, a DAT or dopamine transporter scan can be used to aid in diagnosis. A doctor may also prescribe Parkinson's medication to see if symptoms improve in order to aid in Parkinson's diagnosis. But in the end, Parkinson's diagnosis relies completely on medical history and an assessment of the symptoms. So the symptoms of Parkinson's disease, the largest symptom is tremors, which are involuntary rhythmic muscle contractions that result in shaking. This can occur in the hands, arms, legs, or head. More symptoms are muscle stiffness, slow movement, loss of balance, trouble chewing or swallowing, urinary problems, and skin problems. Symptoms occur gradually and progression occurs differently between each individual. Symptoms start out small and get worse over time. They may appear on only one side of the body or one part of the body, but over time will affect both sides. People with Parkinson's may also experience cognitive symptoms, problems with memory, attention, and may also experience Parkinson's-related dementia. This is also known as Lewy body dementia. So the causes of Parkinson's are very unknown. In some cases of Parkinson's, the disease can be traced down to certain gene mutations or can even be thought to be hereditary, although the true cause of Parkinson's is not known. Is Parkinson's fatal? Parkinson's is not directly fatal, but it is Parkinson's related complications are fatal. Fall risk, which according to the CDC is the leading cause of injury-related deaths among those 65 years or older. This is very prevalent because Parkinson's disease affects balance and can cause muscle spasms, and when this is in the lower legs, it can cause a very big risk of falling. The Center for Disease Control and Prevention rated complications from Parkinson's disease as the 14th cause of death in the United States, according to the Parkinson's Foundation. Treating Parkinson's. Parkinson's disease cannot be cured, but it can be treated with medicine. Medicine used to treat Parkinson's usually aims to replace dopamine lost when the dopamine-producing neurons in the brain die. Unfortunately, dopamine cannot be supplemented as it cannot enter the brain. Medications are often given that increase or replace dopamine. Some of these are carbidopa, levodopa. This is a chemical that converts to dopamine in the brain. Dopamine agonists, which mimic dopamine in the brain, and MAOB inhibitors, which help prevent further breakdown of brain dopamine. So, Parkinson's and exercise. According to the Parkinson's Foundation, exercise is vital for people with Parkinson's and can help improve symptoms of the disease. Um, the Parkinson's Outcomes Project shows that people with Parkinson's disease who started exercising earlier and a minimum of 2.5 hours a week experienced a slow decline in quality of life compared to those who started later, according to the Parkinson's Foundation. Challenges during exercise. Parkinson's disease is a disease that affects the way that people move. It can cause tremors in muscles throughout the body, and early stages can see these effects go completely unnoticed, but later stages will cause decreased balance, decreased strength, decreased cardiovascular conditioning, and decreased flexibility. So the case study I chose to do is Mr. L is a 73-year-old man, and 2 years ago he started noticing slight tremors in his hands and trouble with his handwriting before going to the doctor, where he was diagnosed with Parkinson's disease. He was placed on carbidopa-levodopa medication to help with his Parkinson's disease. He was and still is highly active, going on 2-mile jogs every morning. He played basketball in college and still swims in his pool when the weather is good. He's able to complete all activities of daily living, and when asked about how his symptoms have been developing, he said that they have progressed since he's been diagnosed, but that they have been slow and manageable. Mr. L has recently begun to notice more tremors in his legs while running. And during our meeting, he explained his goals as wanting to be able to run without significant tremors, be more in control of his legs, and to keep balance and strength. Because Mr. L can still do all activities of daily living, I administered a 6-minute walk test, and Mr. L walked 622 meters in 6 minutes, which is above the average for his age group. However, seeing as he is a more well-trained individual, going on 2-mile jogs every morning, playing basketball in college, this may be lower than it has been recently, and his blood pressure and BMI are both within normal range. So the exercise program, for his exercise program, I would keep him doing his daily runs, as this seemed to be his main motivator for doing this strength program. And to keep him motivated and ready to work out, I would keep him doing his daily runs. I would also start to add 30 minutes of yoga twice per week to aid both his balance and flexibility, both of which can deteriorate due to Parkinson's disease. For a strength program, I would start out simple, 3 times per week. I would have him do seated calf raises and tibialis raises, glute bridges, sit to stand squats, sitting on a chair and standing up. I would also have him do high knees on each side, and I would have him hold a chair for balance. So I wanted to explain why I chose each specific exercise. I chose yoga in order to aid with his balance and flexibility, as these can decrease due to Parkinson's disease. And I chose seated calf raises and tibialis raises to help him strengthen and control his lower leg and feet, which is very important while running, walking, going up steps, and doing any activity of daily living. I I also chose glute bridges and sit to stand squats to strengthen and control in the upper leg while running. This is mostly for running, of course, and for any other activity of daily living, walking up steps, getting up from a chair, anything like that. And then I chose high knees while holding a chair for balance because it's more transferable to running, and this will mimic him running better than a lot of these other exercises. It will also help keep his hip flexors strong and strengthen hip flexion. And I also chose to have him hold a chair for balance because Parkinson's disease puts the patient at a very high risk of falling, losing balance, and I want him to be as safe as possible. And because Parkinson's disease is a degenerative disease and symptoms and conditions will decrease over time, Mr. L will be monitored closely to assess his workout program. And I would like to hear feedback from him and be able to tailor the workout program as his disease progresses. These are my citations. Thank you.